Pain with intimacy or sexual pain is much more common than many people realize. It's estimated that 20% of women and 5% of men will experience sexual pain at some point during their lives. Physical therapy can be very helpful with that. The way we look at things in my practice is through three overlapping systems because usually pain doesn't come from just one place. We take a look at your musculoskeletal system, we take a look at your tissue or hormonal system, and then we take a look at your nervous system. And we call in some other health professionals along the way so that you can get the care that you deserve. The musculoskeletal implications for women, we take a look at abdomen, lower back, and hips because all of that can impact what's happening in the pelvis. We take a look at some superficial pelvic floor muscles. So these muscles through here are often a big part of the story if you're having pain with initial penetration, if you feel like your partner is unable to enter or you're hitting a wall, or if you're feeling shooting, stabby pain, kind of open wound, raw sensations. We also take a look at these deeper pelvic floor muscles. These muscles usually show up when people are complaining about pain with deeper penetration, if there are certain positions that are better tolerated than others, or if you feel like your partner is hitting your cervix. And sometimes taking a look at organ placement as appropriate can be helpful when looking at these muscles too. So with men, they can experience pain with erections, pain with ejaculation, and pain following sexual activity. We take a look at, again, the muscles that surround the pelvis, so abdomen, lower back, and hips, because that will play a part in what's happening in the pelvis. We take a look at some of these superficial pelvic floor muscles. Sometimes when there's excess tension, people have trouble achieving or maintaining an erection, and they can contribute to the pain following sexual activity as well. We take a look at some of these deeper structures. Again, there's a lot of overlap here, but excessive tension in these muscles can also contribute to difficulty with erections, painful ejaculation, and pain following sexual activity. Our treatment focuses on restoring coordination, reducing unnecessary tension patterns, and improving circulation. In terms of hormonal and tissue support, some women experience pain to very light touch. In my practice, we use something that's called a Q-tip test. And if that test is positive, we usually refer out because a gynecologist or a nurse practitioner can take a look to see if there's a hormonal implication that can be impacting those tissues, if there's some underlying inflammation that needs to be treated and addressed before physical therapy can work as well as we want it to. And we can help you advocate. We can tell you what things to ask. We can write a progress note just to make sure all of those bases are covered for you. Pain is not just physical. We know that the nervous system plays a huge role here, especially in a place that's as intimate as your pelvis. So if your brain is anticipating pain or danger, doesn't feel safe, it can automatically hold or guard to protect you, even if at that moment there isn't any danger present. Conditioning can be a factor, a history of trauma and abuse, body image, shame, they can all play a big factor here. So our care is always trauma informed and respectful. There have been times when we can work alongside your mental health provider so that you're getting the support and the care that you need to address this as a whole body approach. The way we look at this from a PT perspective can include education, breathing, visualization. We do some graded exposure therapy. We've had great success with vaginal dilators when they're used with the right patient at the right time. We utilize manual therapy, movement retraining, nervous system down training. Everything is very individualized depending upon what your picture is, and we're always very respectful of your boundaries. Pain with intimacy is common, but it is treatable. It's not something that you have to navigate all on your own. And if you're interested in how pelvic floor physical therapy can help, a phone call is always a great place to start. My name is Jessica Lockett. I'm the owner of Pathway Physical Therapy and Wellness in Boca Raton, where we are here to help you find your way forward.